Hi, everyone. Welcome to MGFA's Wellness Series webinar, Understanding Advanced Directives. I'm Jenna Umvalo. I'm the Director of Patient Advocacy and Community Engagement at the MGFA, and I wanted to welcome you all here today. Before we get started, I wanted to go over a couple of housekeeping items. If you have any questions, please type them in the Zoom Q&A box located at the bottom of the Zoom menu bar, and we'll answer them during the Q&A segment. Today's session will be recorded and available online. We wanted to thank our sponsors for today's webinar: Alexion, Argenix, UCB, Janssen, Cabaletta Bio, and Horizon. And we've got a great presentation ahead of us. So I wanted to hand it over to our hosts, Laura Russell and Lauren Haynes from Advent Health Neuroscience Institute for MG. Welcome.
Hi, thank you for such a warm welcome. I'm going to go ahead and pull up our presentation really quick. All right, and as Jenna said, I am Laura Russell, a licensed clinical social worker. I work with Advent Health, and part of my role is to really spread awareness for all neuromuscular disorders, and specifically myasthenia gravis. And this is our presentation on anticipating crisis and advanced life planning. And I will let Lauren introduce herself.
Thank you so much, Laura, and thank you so much, Jenna, for inviting us back. My name is Lauren, and I work really closely with Laura with Advent Health. We do have a myasthenia gravis clinic that we run here in the Orlando, Florida area, and so I'm so happy to have the opportunity again to be able to speak with you all.
Yeah, and we kind of wanted to bring this talk up because it's so important. And when we talk about anticipating crisis, and we'll get into it in a little bit, we really want you to think of advancing disease or changing condition, or just the normal aging process, right? Every time we wake up, we're a little bit older than we were before, and some of the life things we need to start thinking about. And that's kind of where this presentation came into place. And one of my favorite quotes is, "A goal without a plan is just a wish." So we really want to get you thinking about the importance of creating a plan as we kind of move through this presentation. And we did already introduce ourselves. We got excited. But again, I'm Laura and this is Lauren. We're both social workers and we run the Brain Health Outreach Program with Advent Health. And throughout this discussion, this is kind of going to be the agenda we're going to go off of. We're going to define the crisis and what that means in this context. We're going to explore crisis management. And also, I'm going to walk you through how to create a plan to address some of these concerns that you may have. And we're also going to mention the signs of advancing disease stages. This can really be used for anybody, especially someone with myasthenia gravis. But if you have the diagnosis yourself or caring for somebody who has it, or some of us have parents who have advancing ages and different diseases, this is really going to be relevant for just about everybody. And then we're going to, one of the most important pieces is review advanced directives and what these look like. There are several different types, and we're going to kind of break down the importance and what each of those documents mean. And then our goal for the presentation today is for everyone to leave really feeling confident in decision making and how to start the conversation for advanced planning.
All right. Hi, thank you so much, Laura. And I love that you said that a goal without a plan. I think it's really cliche, I guess, addressing this topic. And a lot of people think, I don't really want to think about, what it looks like, what things might look like at the end. But I like to consider this approach like not considering what the end looks like, but considering what life looks like. So not so much thinking what life looks like when you die, but what life looks like when you're living, how that looks, and what you want that to look, and really taking that power back of determining what what that looks like. And so here we're going to define crisis. And I know with myasthenia gravis, this is not a word that's uncommon to anyone living with or affected by myasthenia gravis. The word crisis means a difficult or dangerous situation that needs serious attention. But for the purpose of this presentation, we are going to be referring to crisis in terms of when we want to create an intervention, and why it's important to have a plan before we get to a point of crisis. And so we really want to go into breaking that down for us. So Laura and I got together and we kind of developed these 3 types of crises when we're looking at what crisis is. So we said that there was the creeping crisis, then there would be the slow burn crisis, and then there's sudden crisis. And so for creeping crisis, I can give you guys some details of what we mean regarding that. So with creeping crisis, we're really talking about something that has maybe invisible symptoms. Right now, you're not really affected by it. You might be able to live life with just a few adaptations, and it's fine. Maybe you can't tell that there may be steps that need to be taken. And so that's our creeping crisis stage. A lot of times we haven't quite made preparation for those emergencies or for follow-up with a medical professional, or we've taken steps, but we haven't taken all the steps we need to protect our life or property in the event of an emergency. And so that's our creeping crisis. Next, we would move on to our slow burning crisis. Now, the slow burning crisis, it's really a steady change of functioning that's happening just regularly, and you've maybe just become accustomed to the steady decline, or there might be changes that could be missed or maybe misinterpreted. You might think that something else is going on and then later realize. I hear a lot of people with MG talk about later realizing that something that they thought wasn't that big of a deal, they recognized later was related even to that diagnosis. And so as Laura shared, this isn't necessarily directly regarding MG, but also I think we can relate to that when we're discussing the topic of MG. Or maybe you have had a few adaptations that have slowly needed to be implemented. Maybe you're now having to add additional assistance, maybe for ventilation we see with MG, or maybe you're having to need assistance walking. You know, maybe you are starting to have to adapt, but again, it's still slowly happening. So that third one that we're looking at now is going to be our sudden crisis. And so that's when the condition worsens abruptly. Out of nowhere, something happens. Maybe you experience difficulty breathing. And this is when life-sustaining interventions are going to be considered. A lot of times, maybe the hospital becomes involved at that point. And so you're unable to ignore at this point. And so we want to really encourage making decisions and determining what you want or how you want to live while we're still in that creeping crisis stage, while we're still in the stage regarding our advanced care planning, where you can take the time to make the decisions that are important to you and really make certain that your family and friends, your medical professionals, maybe attorneys, if you've got them, are aware of the things that are really important to you.
Yeah, and really like what Lauren said is we're trying to kind of function within that creeping crisis. We never want things to escalate to the sudden crisis where everything kind of seems to have fallen apart. We're going to the hospital, we're in and out of the hospital, we're having symptoms that are kind of becoming more uncontrolled. And in that regard, kind of life feels like it's falling apart all around you. We want to be able to prepare. So if the sudden crisis does happen, we have a plan in place to really prepare for those moments. Just a small, quick example would be if you did have to go to the hospital and you have 2 dogs at home, who's responsible for those dogs if you have to be taken to the hospital?
Right.
That's something that we want you to be able to consider as part of your plan. Like,
Absolutely.
Is the neighbor going to come over? Do you give them a phone call? And those kinds of things.
Right.
So we are talking about what is the chances or the risk of a crisis happening when we are kind of going through the motions of having a chronic illness. Well, any of us really are at a risk of experiencing a medical emergency. And that risk increases exponentially if you have a chronic illness or advancing disease, because now we have our normal risk level, but when we add a chronic disease or an illness that can give us flares or new symptoms, we're kind of getting closer to that risk of it happening. So our goal is to really be prepared with that plan in place. And part of this presentation is going to really show you how to put that plan together into action. So one of the tools we start talking about is the Advanced Care Planning Toolkit. So we're going to go with the mindset that you've been diagnosed with a chronic or life-limiting illness or general aging, right? Because every day we wake up, we're a little bit older. So it's never too early to start planning, regardless of your status of your condition or where you are. So the first step I want everyone to always process. Give yourself time to grieve the diagnosis that you've been given. There's a little bit of change regardless of what diagnosis you receive. And life is just different. You have to start making accommodations or adapting to new ways of life. And that in itself requires you the opportunity to really assess your life and kind of grieve those different changes. And then, sometimes people say, don't be Dr. Google, don't Google things. But I'm kind of on the believer of it's okay to Google some things, right? Because you want to be familiar with some of the normal disease progression. And if you can understand some of those normal disease progression, you can anticipate, you can plan. It gives you kind of some power. And nobody knows the disease quite like you, because you start to learn how your body feels, how, different changes, just the temperature, you can start feeling a little bit weaker. And then once you kind of have a list or handle of those symptoms and listening to your body, you can start putting in the plan into place to how, when you start feeling these different changes, how do we accommodate that? So the goal is, if we can anticipate disease progression, we can write down all of our symptoms, what's normal for us, what's abnormal, we can start to put the plan in place and make necessary arrangements if and when the point of a crisis happens, and without experiencing that initial crisis feeling. So really the big goal is to be able to plan for the crisis. So if it happens, it doesn't feel like a crisis. It's just the plan. You're implementing the whole thing that you've been planning for, so you don't have that heart drop feeling, the anxiety, the unnecessary rushing around, because you've already been thinking about it. So when we start talking about the signs of advancing disease, this is kind of, and this isn't necessarily linear, right? It's not going to be step 1, step 2, step 3. It can come at all different times, just like the grief cycle. You can be in all different stages. So kind of some good questions to ask yourself. Have you or a loved one been hospitalized? Have you been going to the ER more frequently? Have you visited maybe the ER the last 6 months? Have you been in and out of ICU? Have you noticed that you're starting to make more calls to your physician? You're realizing you're having to use their portal more often, asking questions like, I'm starting to feel more symptoms. Have you needed to change your medications? Are the dosing that once worked, is it not working anymore? Have you started needing more help with everyday routine? So if, for example, getting up out of bed, changing, getting into the shower, if that's causing you to kind of take a little bit more time than it used to, these are some things we want you to be conscious of, because that is the sign of maybe things aren't going as well as they once were. And then, especially for MG, have you noticed that you're starting to feel weaker, more tired, waking up with headaches? These are some of those symptoms that most people could just be like, it's just normal, but it's not. We want to make sure we're really paying attention to those. Have you noticed a decrease in your weight? Is your appetite changing? Do you feel like you need to talk to your doctor that I'm losing weight, but it's unintentional? I don't know why I'm losing weight. Have you noticed a change in your breathing? Have you needed to have respiratory assistance at bedtime? These are some of those things that things are progressing, and we can always try and do things to help us. So say things are progressing. If we put different adaptability in place, we can stabilize. And that's really what our goal is. All right, so now we're at the point to we're going to create our plan. So we already know we are at risk for a crisis happening. We already know it, all of us, right? So the questions that we're going to ask are the who, what, where, when, and how. So first, we're going to ask who is going to be the person that's going to designate to assist you as your care needs increase or change. So who is maybe it's your partner, maybe it's a spouse, maybe it's your sibling. It could be anybody. It could be a friend, a neighbor. It could be somebody you pay to help you. So we want you to think about who are you going to identify as the person who really jumps in when you need help. And that looks different for everybody. And then the next step is the what. So what will you do if your care becomes more than you or your care partner can handle? What does that look like? And then the where. Sometimes people have the main goal of, I want to remain in my home as I age, as I have disease progression. That's the biggest goal to me. And some people think, I would rather go to a retirement setting. So what does that look like as you're planning? So say you're 35. The goal is to get to retirement age, right? So what does that look like for you? Is it to stay in your own home, rent an affordable apartment, maybe be in a long-term nursing facility? So those are some of the questions we want you thinking about. And then when, this is probably one of the most important questions to think about and ask yourself. When will you feel it's time to level up care? So if you are an independent person, you're living at home independently, you're getting by, there's no concerns. At what point would you ask yourself that things are getting a little harder than they used to be, and it would be a lot easier if I had support or help? That's what we're talking about. So when we say level up care, it could be that now you ask your spouse or your partner to take on a little bit more duties around the house, or maybe you cut back on work a little bit. Some of those things are things we want to be conscious of. And then the big one, which I'm sure you guys are all thinking, is the how. So now we know the who, what, where, and when, but how do we actually make these accommodations? So how will you handle these changes? What will be put in place to ensure you and your care partner remain safe, whether that's in your home, at maybe a friend's house or your parents' house, whatever that looks like? We really want to put those plans into place. So start reviewing resources. And a great starting point is to connect with somebody like me and Lauren, or a social worker in your area who really has expertise on kind of navigating those resources, because we all know it can be super challenging, because resources are typically by state, some are federal, a lot are state driven. So depending on where you live, then that would be a big factor of what kind of resources are out there. All right, so let's do, as we were doing this presentation, we kind of talked about, Lauren and I, let's do a case study so we can really see what this looks like in real time. So this isn't a real person, but it's definitely real scenarios we hear regularly. So I will read it out loud, and then Lauren and I will kind of just process through everything. So case studies on Emily. Emily is a 41-year-old female with a 6-month history of myasthenia gravis. She's showing signs of worsening mobility, difficulty breathing at times, and she often needs help from family during periods of weakness and fatigue. Emily is not married, but she has 2 minor children. Emily and her 2 children live together, but have family in the next town over, about 10 minutes away. Emily has been able to work full-time up until recently, when her symptoms became exacerbated. She has had multiple hospitalizations, increased difficulty in breathing, and more fatigue. And she started to have an increased appointments with her primary care physician and her specialist. So as you can see, things are starting to progress with her disease process. She is a young mom. She has 2 kids, and she is not married. So right off the bat, some of the things that we would start picking apart from this is, so it sounds like she does have help, which is a great thing. Her parents are involved and she has family close by. So those are some really good protective factors that we talk about. Now, I am concerned because she has 2 little ones in the home. So how will we make sure if her symptoms get worse that we make sure she stays safe as well as her little ones? So this would be the plan that Lauren and I would kind of create, with obviously the patient or the person creating the plan would be in the driving seat. So our patient's Emily. She's been diagnosed with MG. We know she's unable to work. So one of our big recommendations would be, first step, we need to secure some income. That is very, very important. Most of us cannot go a couple of days without work and without getting paid. So a good first step is to always start with your human resources department. Let them know that you're going to be out of work, you have a medical condition, and you can start and request FMLA, which is the Family Medical Leave Act. A lot of people don't know, but that is a federal program. And it's an act that allows you to have job security if you have or experiencing a disability, or you have to care for yourself or an immediate loved one. So that would be job security. But now we also want to make sure we have some income. So a good option would be to see if she has short-term disability benefits through her work, or maybe she has a private insurance plan. And then as soon as, and this is one of my big recommendations, as soon as you go out on leave from work, it's a great idea to go ahead and apply for short-term disability, which is also known as Social Security disability. And that is a process that Lauren and I really walk through so many of our patients with, because you can always come off of the program, right? A lot of people think, well, if I get SSDI, will I not be eligible in the future? What if I want to return to work? Absolutely. We want everyone to be able to return to work at their comfort level. But in the meantime, while you're going through a crisis or you're not really feeling so great, this will give you some income security. And you can also be eligible for Medicare. And there's so many third-party providers who really can assist the application process, because we all know most people are denied that first time and there is an appeal process. And we never want that to stop you from pursuing that.
Sure.
So then, do you have any thoughts, Lauren, as I'm just yapping my way through here?
No. I think that that's great. You've touched on really everything. And I think that that's a good point also. I know you talked about third parties to involve. And a lot of times when we're thinking about attorneys, when we're doing advanced care planning, we're just thinking that we're talking about, wills and that kind of thing. But also there are attorneys that specifically address disability. And a lot of those attorneys really will allow you to pay maybe towards the end of the road, or some of them even do offer some at least pro bono advice. And so it really is important to involve also an attorney. If you feel like you are not being represented well, then you can also advise an attorney, which is a good segue into the next part. Caregiver and support. So when we're talking about support, Laura mentioned looking for someone like us, social workers who can assist you. Really, as formal supports is really good, or having an attorney who you've talked to or who you've documented some of your wishes with, also for considering running for applying for disability. But in Emily's place, we talked about some of her informal support. That's family, friends. In this case, it's her parents, her ex-partner, which is her children's father. And really, I think that the important thing is making sure that we have a plan with them. Just in every sense, we're looking to make sure from all sides, we've got something in place. So we're talking to the children's father about what that might look like. Maybe he'll have to play a different role than he had been playing in terms of being involved with the children's care in case of an emergency, and also connecting with friends who might be able to help, or other resources that might be available to her. And so I think that that's a really important piece, is understanding and really taking advantage of all of those parts. Also, we really want to make certain that we're answering in that who, what, where, and when, what we can anticipate in terms of the decline. And so I've heard so many people, especially with myasthenia gravis, say the only thing that's the same is that MG is different for everyone. And so in your experience with your disease process, what has it looked like during periods of exacerbation? Sometimes we know that there's signs or they're little things that our body uses to tell us that something might not be right. And so really paying attention, listening to our bodies, listening to the process, like Laura said, nobody knows better than you. And then looking at knowing where you'd like to be cared for. Do you want to stay at home? Is it important to have maybe home health come in or have a home health aide, depending on your state? Some states do provide home health aides if you meet the criteria and if you have Medicaid, or maybe you have to pay for something like that out of pocket, depending on the state that you live in. And so really understanding where you're going to be when you are experiencing that crisis. So in this case, her parents are retired, and so maybe she can stay with her parents during those times if she's not comfortable going to the hospital. I think some other pieces to consider are also when. So like I talked about a little bit is, are we going to consider home services, or are they bed bound? What does that look like? Does she require assistance moving in and out of bed, being transferred? And in this case, maybe it would be a good idea for her to consider something like a skilled nursing facility or an assisted living facility if she meets that criteria. And lastly, we kind of talked about this in our who, but how. We want to connect with an attorney and discuss those Medicaid long-term care planning and go over our advanced directives and also understand the community resources. So those are some important pieces when we're asking for who, what, where, when, and how, especially considering this specific scenario with Emily.
And I think a good kind of tip for us is to write down or initiate what I call a phone tree. So whenever we have kind of any kind of life planning, I know my family, if there's ever an emergency for my kids, we have a phone tree. So I'm only responsible for calling one person, but that person's responsible for calling the next person and then the next person. So I don't have to think about calling all these different people to start my plan, because it's already in place. I'm just responsible for that initial call. So that would be a great tip for you to have if you know, for Emily, if she starts to feel weak or have difficulty breathing, the first thing, she can start her phone tree. Call, it sounds like mom or dad might be the first person, and then they are to call the children's father, and then they can come and make sure they're cared for, and then she can focus on her health to get back to a normal state. So that's really, really what we like.
And Laura, I'm sorry, but just to piggyback off of that, it's also important to have more than one form of communication too. So if there's more than one phone number that they can be reached at, we want to make sure we've got that. If there's an email, we want to make certain that we have all of those things documented as well. And even having like a little folder or a little notebook that says, this is where our emergency contacts are, and this is the process that we want. I think just documenting it is really important. So I love that you said that.
Yeah, and it's so important. And really, that is honestly like creating your little healthcare binder. So you can tell everyone in the family, like, these are the medications, this is my favorite hospital, these are the doctors that have my contact. And that way you're not feeling out there flying solo. You have other partners involved in your care. And then some of the other things that are just good tips and tricks, just like the call tree or having your folder prepared, complete the medical alert form. The MGFA really has a great form that you're able to wear bracelets, so it's giving an alert, or you have your card listing with all of the pertinent information if you go to the emergency department, because Lauren and I hear often from our patients, we're really scared to go to the ED. And absolutely, one of our big goals is to educate all of our hospital systems to make sure people can feel safe going in and you are getting heard with the information that you share. So some of the long-term thoughts is to start reviewing the cost of care. This changes every year, unfortunately, with inflation, healthcare, reimbursement amounts. So it's really important to kind of stay up to date on the costs of what nursing care looks like, what in-home care looks like, physical therapy, different things like that. It's important to really kind of keep track of some of those costs as you make your life advanced planning. And then pretty much we're going to be transitioning now to the actual documents that will help support what your plan is. And then, so we'll go transition to over here, and then Lauren's going to start talking about the actual documents.
Right. And so I love too that you added, Laura, the MGFA, if you guys have not connected with the website and looked at all of the documents that they have there, there are lots of really great documents that really go into detail. The emergency alert card is really good. There's a cautionary drugs list there as well. And that's been really beneficial for so many people who we've worked with. And some of it you can print out, you can personalize. And so make certain that you are utilizing, again, that's one of those resources we talked about when you're coming up with a plan. The MGFA website is really incredible in terms of offering a lot of advice, and they will mail you out a packet. We've had Jenna really help us with a lot of patients with that too. And like Laura said, being able to wear the wristband, I've heard so many people talk about using their card and keeping it in their wallet, and just how beneficial it feels, and really that power that you're taking back when you know that you're knowledgeable. You know, they say knowledge is power, and it sounds so cliche, but it really is so true. And when it comes to your healthcare professional who's seeing you, it's really important that they're also knowledgeable on the condition. And so going on to advanced directives, you may have heard of an advanced directive before, and this is something that you might have completed with an attorney. Sometimes I know our hospital system does offer its own advanced directive, which we'll go over in a little bit, but it's really a legal document signed by a competent person to provide guidance, medical and healthcare decisions in the event the person becomes incompetent to make such decisions. So in this case, we're really talking about, you know, what to do in crisis, but honestly, there's really never a time that's too soon to talk about what you would want, what you would like. If you're in a place where you're competent, this is meaningful for you. This is really something that you should consider looking at or documenting in terms of your needs. So here we've got a list of different types of advanced directives, and there's several different kinds. They all serve different purposes or have different criteria in order for you to be able to meet them. But our first here is the durable power of attorney. And that one is when you appoint a person or entity to be responsible for making decisions on your behalf. So this might be medical, it could be financial, or it could be about personal decision-making abilities. And so like with Emily, she might have a POA in charge of finances because she knows that she's got little kids, and in the event of an emergency, she wants to make sure that her kids are protected. And then in terms of making medical decisions, this would really be the designation of a person. And so that's usually specific to each state and usually completed by an attorney or with an attorney, and it will be notarized. So that is that one. And then we've got a healthcare surrogate.
And something before you move on to really note about the DPOA is that this is a living document. So what's nice about it is typically, and depending on your comfort level, you can have the verbiage by an attorney say, you do not want anybody to have the power to make decisions while you're competent and able to.
Absolutely.
Or some people like to have a partner be able to make dual decisions. So with this document, you can designate a person to help make medical decisions, financial decisions while you're still within capacity. So say somebody needed to go to the bank on your behalf, they could do that. So that's something that's kind of a smart portion of having the DPOA.
Right. And really that clarification, because as Laura said, maybe you don't want someone to make decisions while you're able to make them for yourself. So then this is where it would be important to specify either way, but then maybe you're okay with someone having access to your, you know, information. Maybe that's what you want to clarify. Maybe you want to say, yes, this person can have all of my information. And it's something that generally the hospital or your medical care professional should really go over if you're competent to make certain that that is still the standard. So yes, our DPOA or POA is going to be our first one. And then here we also have our healthcare surrogate, which is a person who you may trust, who you provide the privilege of being able to make your medical decisions if, again, you are unable to. And a lot of times we do see the opportunity to do that in a hospital setting or at a doctor's office. I've also heard the term healthcare proxy, which we'll get down to as well. And it's really very similar. Our hope when we're discussing this with you on the medical side is that you've discussed with that person your expectations for care, but a healthcare surrogate document may not address what your expectations for care are. It's just designating a person. And so that would be what that is. And then that's when we move on to the living will. So the living will is really what would go into detail in terms of what your wishes are regarding things like life support. And again, going back to the MGFA website, it talks about something like a ventilator. Sometimes because of the muscle weakness it describes there, you might experience respiratory failure. A ventilator may be beneficial, that may be helpful. And so understanding that part of the disease process with MG, and then also understanding that a living will may address something like ventilation or life support treatments if you get very sick is really important, and then really specifying what you would want those interventions to look like. This is your opportunity to really think about those things too. So sometimes I tell people, hey, you don't have to do this today. That's why we do this in the slow burning crisis or before the sudden crisis. Let's sit down, let's talk about it. Let's consider all of the possibilities when we're looking at interventions. So these things can really be helpful, and it can make the difference between prolonging life and really what the end of life looks like. Going back to what I was saying in terms of it's not so much a decision regarding death as much as it is a decision or decisions regarding how you will live. So this is really to make certain that you have a voice, that your voice is heard, and that it's understood when you're unable or if you're unable to speak. So life support treatments, we talked about ventilation, or you might hear intubation. Those two words are often used interchangeably. Maybe artificial feeding, IV fluids for hydration, blood transfusions, maybe dialysis. These are all important things that you just want to make sure your voice is heard on. Going back to the healthcare proxy, that also is a document that will name someone who you trust. A lot of times it might have you name even two people. So if that person is unavailable, then I would like person B to be available if this person cannot make decisions for me or is unwilling to make decisions for me.
Well, and the big key thing with the healthcare proxy is it's going to be state specific. So if you haven't looked up your state statute, of course, we're out of Florida, so we're pretty familiar with our Florida statute on our hierarchy. So if you don't have an advanced directive, if you've never designated somebody, the state's going to designate somebody. And it's going to go based on the hierarchy for the state of Florida, which majority of the states do follow the same hierarchy. It's going to be a legal spouse, adult children, and kind of go from there beyond to maybe a family member. So that's why it's so important. We want to designate somebody because it could be somebody maybe you wouldn't have chosen for yourself if it goes in the legal proxy. And then sometimes if nobody can agree or find somebody, the state will get involved or the legal system, and they will be responsible for making some of these decisions. So that's kind of the really big piece about this.
Yeah, no, definitely. And in Emily's situation, so Emily is divorced, but say Emily was separated, even if she had been separated from her spouse in the state of Florida and in many states, even if she'd been separated for 20 years, the state will say, which I think that she's only 41, but the state would say, well, this is her legal person. If she hasn't designated someone, it doesn't matter if they haven't spoken. It doesn't matter if they've never talked about this. It doesn't matter if they didn't know about the disease process. That is their legal appointed person. Now that person can defer to the next legally appointed person. And in that case, it would be, as Laura said, for the state of Florida, it's your spouse, your adult children, and then parents. And then it goes on to siblings. And once you get to siblings, if you've got more than one, then it has to be a consensus, a decision that's made by consensus, or there needs to be someone designated. And so when you get into that nitty gritty, it really does put it into perspective that it's important and that you really do want to have something documented. And although we often do oftentimes we do suggest or recommend that you have that document notarized. We understand that that's not always a possibility. And in the state of Florida, there are documents that allow for you to have 2 witnesses. Only one can be a relative and neither can be the person designated. And so if you don't have access to those things, but you have access to a computer, there are documents that can be signed without being notarized. But of course, that's always our preference and our recommendation, just to have that document notarized. So yeah, Laura, thank you for bringing that up. That's a great point. Here we've got another one, 5 wishes, and that's really a popular document, which is also an advanced directive. It goes into some of the things that I really like wish 4 of the 5 wishes asks how I want people to treat me. I want someone to hold my hand. I want someone to be beside me. Or wish number 1 is who makes those decisions for me, like we talked. Wish number 2 is the kind of medical treatment, so kind of going back to living will type of thing. But wish number 3 is how I wish to be comfortable. So that could be like, please make sure that I have chapstick on. Make sure that if I can't put chapstick on, I have chapstick on. I don't want my lips to be dry. And then 4, like I said, is how I want people to treat me. I want to make sure that someone is praying with me, or I want to make sure no one prays with me. And wish number 5 is what I want my loved ones to know. So that really gives you the opportunity to let your loved ones know things that are important for you, that they know in terms of if that crisis leads to something more. And so this is your opportunity to talk about what your final wishes would be, or how you wish to be remembered, or deal with matters like forgiveness. And so I really, really, really like the 5 wishes document. They do have a website. And so if you're interested in that form, then you can download it from there as well. Also, we did not want to forget to touch on DNR forms. So that's really different. Although your living will may address wanting to be DNR, or your 5 wishes form, or whatever form you have may address the DNR as well. A DNR document is not the same and does not take the place of an advanced directive. And so it would not designate a person for you. And if those are your wishes, then that's really something that you should talk to your next of kin, or the person who you've designated to make those decisions for you. That's really something that's important to talk to that person about. So here in the state of Florida, that do not resuscitate order was developed by our Florida Department of Health. And then you can have one for the hospital, and then you can have one for the community, and those 2 do not translate. And so if you've been in the community with a DNR, you'll have to do another one in the hospital. And if you've been in the hospital and you've signed a DNR and you want that to also exist in the community, then you'll also need to make certain that you've got a community DNR completed. Another important thing that I want to say regarding this is that it can always be changed. If you did it today and then changed your mind tomorrow and did something else, that's fine. You can do one every day of the year if you want to. You can change your mind. But the most recent document that your healthcare professional has signed is going to be the one that they pay attention to. So I always tell people, make lots of copies, give lots of people copies, even if they're not the person you've designated. Hide one in your drawer, under your bed, under your pillow, wherever you would like to also have additional copies. Make certain that you have multiple copies. Give them to your doctor. If you're going to the emergency room, make sure that you're adding that to we talked about having maybe a folder, having some of the resources from the MGFA, include this there too. It's really important because, as we said, if your voice is unable to be heard, say there's a circumstance where you do end up intubated, a lot of times that also involves you being unable to speak. We want to make sure that all of your decisions are respected. And so that's our little overview of the different advanced directives. And next, we're going to go over Advent Health's specific advanced directive form. So this is the one that we have on file. Our doctor's offices often have it, as well as the hospital system itself does have it and recognizes it. And even if you do it with our hospital system, other entities will also acknowledge it. It was done meeting the criteria of the state of Florida. And so if you don't have a doctor within our hospital system, you can still use it. Now, depending on where you are, please make certain that those rules are the same. And I actually I found a few websites that had different types for whatever state that you're in. And so AARP, their website, aarp.org, lists different free advanced directive forms for your state. Also, caringinfo.org has several different ones for your states or territories. The American Bar Association, from what I found, they also do have different forms, everplans.com, and we can make certain to make that available for you after, if anyone has questions. If you want to reach out, then we can make sure to send you those links to what your different states or how to get in touch with advanced directives that meet your state's requirements. So moving on, this is our specific, and I'm just going to brush through it. You'll have your name. Here for our healthcare surrogate form, you've got two different options. So you would put your primary healthcare surrogate, and as I mentioned, if that person is unwilling or unable to perform those duties, then you want to make sure that you have a second person. This one only asks for one phone number, but as I mentioned, if you can list two phone numbers, I think that's always really great in case that person can't be reached at the first phone number. An email, I think, is also really good. This form does give you the opportunity to provide an address so that if someone can't be reached by phone or hopefully email, then you can try to reach them at their address as well. And then here is where you do some of those specifics like what Laura talked about. So this person has access to my information. And in this case, if you didn't initial it, then that person would not have access to your information. And then the second part of it says this person does have access to my information. However, I will be the person to make decisions if anything comes up. And so you can also add additional instructions here. I've seen people even like write something out and staple it to the back if there were more instructions than just that. And then you'll make sure to sign it. As I said, there are two witnesses for this form. One can be a relative, the other one, preferably neither of them being a relative, because we want to make sure that they also don't have any other interest at heart. And then neither one of them can be anyone who was designated. So in Emily's case, if she designated her mom as number one and her dad as number two, they could not be the witnesses to that document. And as I said, this particular form is recognized in the state of Florida. It does not need a notary, but please check with your specific state. And then this goes on to our living will form, our healthcare surrogate form, designated someone. And these are specific for healthcare. I know we talked about big picture financial decisions or decisions regarding children, but this is specifically for healthcare. So this goes into options like what it would look like in a persistent vegetative state, end-stage condition, terminal condition, or not wanting life support treatments at all. And then you would sign here, again, the same rules apply for witnesses. This does not, again, take the place of a DNR, of a do not resuscitate form. So go ahead.
Well, and I think, yeah, and I was going to say, I think one of the things, as you can see, these are very widely used and these are pretty generic. And this is what you're basically going to find. And that's why it's important while doing healthcare advanced directives are so important. They're not very personal, right? This leaves a lot to the imagination. And that's kind of why there is benefits to meeting with an attorney, because you can really go into great detail. Because MG has a breathing muscular respiratory condition attached, it's going to look a little different for people going through this diagnosis versus someone who's aging and wants to avoid maybe CPR and then a ventilator, right? These conditions are different and unique. So somebody can often go to the hospital, be in ICU, receive treatment, be intubated, and also extubated and be okay. So we want to make sure when we're doing your advanced directives that you're very specific to the person you're designated to help carry out some of these wishes. You don't want to be extubated too soon, or maybe not intubated because of your condition. And if you want to avoid at all costs, that's important for everyone to know. These do kind of touch on those issues, but it's not necessarily specific for a condition that's neuromuscular that impacts your respiratory system. So that's something really important to consider.
And it's really good to talk to your doctor as well. So we've met with individuals before who were like, wait, I don't remember hearing about that, which maybe they did, but when you get your initial diagnosis, it's a lot. There's a lot of information. This is a lot of information too. So really taking the time, like I said, don't rush yourself. If you're in creeping crisis mode or slow burning crisis mode, don't make it a rushing thing. I mean, of course, we do want to be prepared, but talk to your doctor, talk to your family, talk to the people around you so that you have an understanding of what does it really mean for me to be intubated? What does that impact? What is the process? So you understand what's happening as well. But use all of those people, consider them part of your who when we're talking about supports. We have our family, we've got our friends, but consider those formal supports, your doctor, your attorney, professionals who are familiar with the condition. Consider that part of your who as well. And so, Laura, I'm so happy that you talked about that. It is really, this is really black and white, and MG is gray. And so that's why we want to make certain that we're ahead of what may be to come.
All right, so the big key takeaways, and I do see there's questions, and I promise you we're going to get to them, and we're pretty excited to answer some of them. So the big takeaway from today is to think, talk, document, share, and continuously review. So think about what matters most to you and talk to your loved ones. You really, really don't ever assume somebody knows just because you've had the conversation. I remind my husband all the time, remember, if this happens, I want this, I don't want this. And it's important to have those meaningful conversations. We never know when something can happen, whether it's a car accident, a healthcare scare, anything. We want to just be prepared. Put it in writing. Don't assume somebody knows, and share it with the physicians and your healthcare proxy. And then the most important is review them at least once a year. Sometimes they become outdated. Sometimes you have a relationship change, or maybe your 17-year-old is now 18 and you want them to be your healthcare surrogate. There's so many different life stages that happen. Maybe you move from Florida out of state and now you need to update those. All right, and then we do have a bunch of resources, and we'll get with Jenna if you guys have any interest. And some of those are caregiver tips, how to develop the emergency plan. And then I have a really cool what if questionnaire. Really, I mean, it's kind of a downer, I'm not going to lie, because it does get you thinking about all the possible scenarios out there. But then it kind of helps you work through each of those and see what is it that you would do. All right, so I will stop sharing my screen so we can see some of these questions.
So I did see that, which one? I did see that there was a question about where to get some of those documents. My doctor's office doesn't have anyone that can help with these documents, and I can't afford an attorney. Where do I go for help? So I will share those. I'll share some of those websites right now. I can pull those, and then also we'll share them with Jenna. And then if anyone has any questions, we'll also share our email, and you can reach out to us as well.
And you can definitely utilize you or us. We are free service, and we are happy to talk to you about this all day and all night because it's so important.
Right.
And then, of course, Jenna did attach the emergency alert card that we talked about. I love it. Highly recommend. And Sue did mention most banks and credit unions will notarize for free, and you're absolutely right. I highly recommend 2 witnesses are typically enough for most states. However, it does not hurt to get that extra security. Just know when you go to the bank to get something notarized, the person who's going to choose needs to be alert and oriented and not under any pressure to choose the person. And I love that it'll be notarized.
And they need to have a valid identification.
Yes, that is very, very important. And one of the questions is, how do you recommend starting the conversation of kind of what your goals would be? And that's a great question. And we can share, if we can give, if you can get your emails to Jenna, the 5 wishes document, that's probably one of my best conversation pieces. I'm super comfortable because I've been around in healthcare, but some people aren't as receptive, especially sometimes as we get older, it's a little taboo of a topic. So my big number 1 recommendation is to start little. Like, find an article of where something didn't go well for somebody and say, hey, what do you think could have been better for this person? And then using the 5 wishes document, and it's available online, it literally goes through in very gentle terms. What would you want if this happened? Or what is the most important to you as a person receiving care? And then sometimes the best way is just to jump right to it and kind of pull that Band-Aid and just start that conversation.
And I think, I mentioned cliches before. I think that sometimes we don't recognize that people actually might be more willing to talk about this than we think. And again, like I said, I mean, there's not really, although we want for everyone to at least have talked about this by the time sudden crisis comes, there's honestly, every person is in a slow burning crisis mode. Every person should have something documented, because you never know when an emergency could happen, like a car accident or like I don't know. You don't know. You don't know what could happen. And so in the event that something like that happens, especially with MG, it's still important to know the medications that you shouldn't use or the interventions that are appropriate or not appropriate. Those conversations are still really important to have. And so I think that because it's a topic that so many people feel like you don't want to talk about it, you don't want to make people sad. Laura and I actually both have worked, now we work more with people in the community, but we both worked with people in the hospital. We both worked with people towards the end stages of their life. And I think we can both say that we've not encountered people who are like, I wish that no one talked to me about this. But we have encountered people who have been like, I wish that someone told me. I wish I had the opportunity to speak. And there've been so many times where someone has told me their wishes. Someone has told me their wishes. I've been in the hospital with them and they've told me what they wanted, but it wasn't documented. And the family comes in and they do something that's against their wishes because, for whatever reason. And for me as a healthcare professional, it's awful. It's awful to see and to know that someone really wanted something to be a certain way and those wishes weren't respected. And so I think that although it's a difficult topic to bring up, I think it's oftentimes most difficult for the person saying it than it is for the person receiving it. I think a lot of times that's at least what we've experienced. The majority of the times, there's always an exception, but the majority of the time that's what we've seen.
And once the conversation's done, it's kind of done, right? So I know sometimes people are like, oh, it's morbid to talk about funeral home or any of these arrangements. There's got to be some time, right? Everyone at some point is going to need those things. Once it's talked about, once we have the plan, it's done. And then you can go live your best life. And that's what's most important, is that we're not leaving anything to question, which is the most important. All right. Is there any other questions that we could possibly answer? And of course, I did put all of our information in the chat. So if anyone wants to send us an email or connect with us, we are always happy to help. We're not just, we don't just cover Florida, which is nice. We're kind of all over the place to offer our support.
I'll put my information there too. I also included the 5 Wishes website. So I think that there may be a cost associated with that, but there are several like hospice agencies or palliative care teams who do have copies that they do give for free. And so even if you just call one of those places and just say, hey, do you have something that I can have? I'm not looking for those services right now. A lot of times, because for us as healthcare professionals, it really is beneficial for us. I mean, we're really grateful when we know that someone's wishes have truly been heard, and really people are able to live with dignity, and really with just that power. And I think that that's really the other perspective switch to look at it as: you don't have power over MG, you don't have power over the unexpected, but you do have power over this part of the outcome. And so we really, really, really want to make it feel like an empowering tool rather than a depressing tool.
All right. And I think that pretty much concludes. So thank you so much for listening to us. It's something that we're both very, very passionate about and wants to spread awareness. And We're hoping that you have some great tools to create a plan should you ever need it. And that way you don't have that heart drop panic feeling. You're really able to kind of work through some of those things that maybe you haven't thought about in the past. And again, if please reach out to us, we are happy to help however you need.
Thank you so much, everyone. Thank you for coming.
Thank you so much, Laura and Lauren. Thanks everybody for joining. Have a great rest of your day.